Hi, good evening, everyone. Welcome. My name is Duran Kidd. I am the president of the GPH Alumni Board, Alumni Association. Thank you so much for being here. We really, really, really appreciate it. And for all of us or all of you that are joining us virtually, we thank you as well for joining us this evening. We have two amazing panelists that are going to be providing us with amazing insights into not only their journey in public health, but also, what it means to be a leader in public health as well as taking the traditional and non-traditional pathways in their careers. I think you're going to find a lot of what is discussed today to be really not only insightful but also truly like engaging, and also really our intent here is to really open up not only our students within GPH and not only the alumni, but also, as we know, this is Alumni and Families Weekend, so the families as well around their perspective on public health and the impact that it's driving today. So with that being said, I'll go ahead and begin by introducing myself and just giving you a little insight into who I am, and then I'll hand it over to our panelists to do the same. So again, my name is Duran Kidd. I am a GPH graduate. I graduated in 2014. Currently, I work at CVS Health. I don't know how much everyone here knows about CVS Health. They are the largest healthcare company in the country, Fortune 6 company. I actually currently work on the insurance arm of the company. So CVS is broken down into three parts. The retail arm, that's our retail pharmacies that you see all over the city, all over the country. And then we have also our health insurance arm, which is Aetna. CVS owns Aetna as well. And then there's the PBM, or pharmacy benefits management portion, which is known as Caremark. So I work within the Aetna arm of the business currently, previously worked in the retail arm of the business. And I have a lot of prior experience in population health, primary care, care management, consulting. So again, that's a little tidbit about me, but you guys aren't here for me. You guys are here for the panelists, right? So we'll go ahead and jump into things now and begin by allowing our panelists to introduce themselves. With that being said, welcome. And let's kick off with our first question. And as you kind of tell me a little bit about not only your journey and tell me a little bit about what you're doing now, bring our audience, bring our attendees up to speed in terms of the career path that you've taken to your current role. So welcome again.
Hey, so hi everyone. My name is Felicity Duran. I also work at CVS Health, but I work in the retail arm, but more specifically with immunizations. How I got there? Well, it was really weird. So I graduated GPH in 2019, right before the pandemic, which happened to be really timely for me. I was in clinical research for like about 2 years. I knew I wanted to leave. The whole time I was in school with GPH, I knew I wanted to be more involved with immunizations. So I was looking to leave clinical research already. By the time 2020 happened, they were really looking for people in public health, the city was. So I joined Health and Hospitals and was part of the Test and Trace Corps, which was later known as the Test and Treat Corps. And I was heavily involved in vaccine distribution, comms for the city internally and externally, and education on COVID. And then as the pandemic started winding down, I eventually left Health and Hospitals and the Test and Treat Corps and joined CVS Health. And my journey basically through all of the craziness of COVID and me wanting to be in immunizations kind of brought me into the immunizations team as project manager.
Thank you so much, Felicity. Really appreciate that. Now go ahead and hand it over to our second panelist.
Hi, I'm Elena Kromeyer, and I graduated a long time ago, in 2009. I can't believe time's just gone by so fast. I'm currently doing my doctorate. I'm ABD now, all but dissertation, at Rutgers University in New Jersey at the School of Public Health. I'm in my third year, and I think what brought me to a doctorate is just years of work in a variety of public health, I guess, like fields and jobs. And I graduated at a really hard time in 2009 when nobody was finding a job. In fact, most of my classmates had to move back home. I was lucky and I got a job with NYU actually, and I was doing research. But through all the roles I've had, which really has spanned maternal health, chronic disease prevention, I've worked in intimate partner violence. I've worked in childhood obesity prevention, tobacco prevention. So I've done quite a bit. I realized that there is this sort of recurring theme that I kept seeing in all my roles, which is that sort of intersection of what's human, animal, and environmental health. And I especially saw that in my work on tobacco prevention. I think in public health, we focus primarily on human health, right? So I realized, though, that through my work that there was so much that we weren't looking at or considering in terms of tobacco, and that's tobacco's impacts on the natural environment as well as non-human species. So that's what brought me to my research focus, which is One Health. And it's that intersection of human, animal, and environmental health. And I hope to see more public health people in the world of One Health, because it's primarily vets, medical doctors currently, but human health is certainly a component of it. So we need more public health people. And I'm researching the One Health implications of filtered cigarettes and disposable vapes.
Amazing. Thank you, guys. I really appreciate hearing more about your journeys and your introductions as well. And before I move on to the next question, I wanted to also just make sure I established a couple ground rules so that we're all on the same page and we know how things are progressing. So apologies for not doing this at the beginning. First, we're going to go through a series of questions for the panelists. And then after, I'd say about 30 minutes, at this point, another 25, 30 minutes, we'll move on to Q&A. We'll begin with taking our first question from our attendees that are joining us virtually. And then we'll move on to kind of alternating and allowing questions from the audience. And we'll go back and forth just to make sure that there's an opportunity for everyone who has a question to provide it. But again, now that those ground rules have been established, again, welcome. Again, I know I saw a few folks roll in as that first question was being addressed. And we'll go ahead and move on to our next question for our panelists. All right. So when you think about not only your role, but also your career, you both touched on your journey, your career path in public health. What are some of the skills or even the areas of expertise that you would consider core to both your role and your career as you think back and reflect?
Yeah, sure. Definitely emphasis on management skills. So obviously, like, I'm a project manager now, so that makes sense. Project management has already started to be a very interesting and pivotal role in a lot of things public health. So just baseline project management skills, a lot of the things that you do learn as core practices while you're doing your MPH, like the social determinants of health, are really important as well. Maybe in a more broad spectrum, it's some kind of something that you would keep in the back of your mind, especially for me, when I was doing things with health and hospitals too, when you have to put messaging out in core communities that might be vaccine hesitant. I have to kind of think on ways that people might be affected by COVID in different ways, and core things like that help as well. And communication skills definitely top up there, especially when you're working with different communities, when you're working with patients and patient populations, whether it's in research or otherwise. Being able to speak with people in ways that they understand, and also being able to speak with people in your team, because everyone comes from a different background as well.
Thank you. Thank you. Second panelist, what are your thoughts?
Well, I certainly agree with Felicity. Definitely social determinants of health are just core to our work. I think in addition to that, research methods, I've taken that with me basically to almost every job I've had. If you work primarily for local government or a health system like a hospital, you're going to have to do community health needs and now community health needs and assets assessments. So that came in really handy, I think, in my MPH, as well as the internship that I did as part of the MPH curriculum was working with a community-based organization, I think Make the Road, New York, in Bushwick. And we had to design a survey and go out and actually conduct the survey. I think that's been really key, as well as like conducting key informant interviews, focus groups. You see these sort of skills pop up a lot, at least for me in my career. One thing I wish that we would have had more of, I'll say, is, and you mentioned program management and managing people, is psychology. And I always say that I teach now at Rutgers, to my undergraduate students who are public health majors, is if you can take a psychology course, because so much of what we do is behavior change, right? Or we try to do, and so much of that is human psychology. So if you come to public health with a psychology background, I think it's really helpful.
Great. I have a question and either one of you can attack this question. Social determinants of health, or SDOH. I think for many of us that work in public health, we all know what that is, but we also have attendees, both, here in person and virtually, that don't necessarily know what social determinants of health and what that entails or what that means. Would one of you mind speaking towards that just a little bit?
I'll put my professor hat on. I guess I would define it as all of the different drivers that impact or shape a person's health. So anything that happens outside clinical setting, right? And we know that these drivers are much more influential in someone's health. So policy, politics, your built environment, access to food, access to healthcare. So all of these sort of drivers that shape us and determine the health that we have. So I would define it.
I agree with you. You're the professor, so definitely probably the more accurate answer. But at least for me, I definitely kind of think of it also from like an anthropological background, because I also have a little bit of background there as well. It's like even things like people's language and culture determines how people view what is healthy to them, what might be affecting them in ways that maybe not everyone can understand. That's also part of social determinants of health.
Thank you both. And just really quickly, if you're not familiar with social determinants of health, there's often a phrase or a statement that's made within public health that says a person's zip code can tell you very much so, both the impact that this will have on their health, their ability to have access to proper health care, proper resources. But it speaks towards the points and the information that you just heard from both of our panelists. So it is a very big issue and a big topic in the field of public health. So I'm glad that they both brought that up. With that being said, we'll move on to our next question. So when you reflect on your time within GPH as a student, when you think about those classes or those experiences, like internships, for example, that set you up for success, when you think about these things and these experiences, how and what impact did those classes have or those experiences have on your current or your ability to reach your current role, or even just throughout your entire career when you reflect on that?
At least for me, I was pretty heavily involved in the Applied Global Public Health Initiative, and then through that I was part of the NYU Center, CISA, Center of Studies of Asian American Health. So a lot of the ways that I learned like research through them definitely helped, especially in the beginning for clinical research when I was in that field. And then it helped a bit when I was kind of compiling reports together for health and hospitals. And again, with like zip codes, that's actually very true. We were seeing that data everywhere. And then again, with the timeliness of it, I did take a course in 2019, right before I graduated, called Behavioral Communications and Global Epidemics. So that one, there was a lot. We worked with WHO and UNICEF there, and kind of like did like a simulation of what if Lebanon had a breakout of measles, and that for sure helped. And then the course management courses and bottleneck analysis with global health helps, and social epidemiology.
I touched on this a little bit before, definitely research methods as well as stats. And I'm still not super strong in biostatistics, I'll admit, and it's sort of been the bane of my existence, but it's so essential, especially if you want to go on to do a doctorate. You can't escape stats, right? At the time we were doing it, when I was at NYU, we were doing SPSS, which is like sort of like, what's that now, and all this software just like changes so much, so you have to keep like those skills relevant. And we use like RStudio in my doctoral program. So yeah, I think also budgeting, we had that. I think program planning and evaluation, we did some budgeting, because if you're going to run programs, and you probably will at some point, you're going to have a budget, right? And you have to know how to manage a budget. So that was really helpful as well.
Great. When she made the point around SPSS, and you, of course, that I recall Felicity mentioning also, I saw a couple of heads nod. I see a couple of smirks. Okay, so it sounds like folks are familiar with these courses and these experiences. As someone who historically didn't necessarily like taking classes in biostats or data-related courses, the point that was just mentioned, whether you're pursuing a doctorate, or I would say in general in your career, especially particularly in public health, you have to just find a way to be comfortable with it, because it comes up one way or another. So I'm glad that those points were brought up. Thank you for your input from both of you. So, you talked a little bit about the courses, you talked a little bit about your experiences, maybe in your internships, and the impact that that's had on your career journey, the impact it's had on your role, right? But when you think about the degree that you came out of, this esteemed program of GPH, how do you leverage your degree in the job search process? What have you found to be helpful and useful in terms of strategies of leveraging your degree in that process? So for example, when you think about the coursework that you completed as a student, or projects that you've completed, or even an internship that you completed as a student during your time at GPH, and you are now leaving the nest, you're moving on and you're looking for a job. What has been helpful for you in terms of the strategies to achieve the success or the goals that you have?
I would say definitely in the beginning, when I didn't have as much experience as I gathered now, the thing that I got the most questions on was definitely the global epidemics class. But I did leverage that experience really well, because the fact that I was able to have a team with people from different backgrounds and WHO already, I kind of said, that means that I could work with a bunch of other people from different backgrounds. I have the capacity to work on a team to make a project that is successful. And then as far as my internship with GPH, I did it through One World Health, which is a nonprofit organization that works to set up clinics in different countries that might have lesser access to healthcare. So this particular internship I did in Uganda, and with One World Health, and I was able to conduct research on hypertension there, and talk to the patients one-on-one, talk to the actual clinicians. And I used that as well to say, like, that also means like I have the ability to talk to patients and be able to understand them in a way that, might be more personal. And then of course, like with management courses, like we already have a bunch of projects that we would have to do. So I used that as well as examples. If I don't think I still have my portfolio, but I did keep my portfolio for a while as examples.
Great, thank you.
Honestly, I've been out of like the MPH so long now that I'm trying to remember back when I was looking for a job, you know, when I was about to graduate, but honestly, like, besides like what software do you know how to use? Can you analyze data? I've never really gotten questions about the courses specifically that I've taken. And I'll tell you what what you really have to leverage, I think professionally, is who you know. And it's who you know, who you know, who you know. And I've seen this just become much more pronounced, at least from my experience in public health. So broaden your network as much as you can. And I tell my students this all the time, you know, like get on LinkedIn, connect with people, reach out to people. You have to become your own like advocate for every job you're fighting for. And you're fighting along with hundreds and hundreds of people sometimes, especially if you're in this city. It's super, super competitive. Often people don't even know what public health is, you know, so you might have bosses that don't have a background in public health and they think that like public health and something like social work are very interchangeable. And, you know, I say, no, there's a little overlap, but fundamentally we're very different disciplines, right? So I tell people, get off your like TikTok and your Instagram and spend time on LinkedIn because I mean, I don't know how many interviews I've had because I knew someone that knew someone. And it doesn't mean that you don't deserve the role because I have the credentials, I have the experience, but you're competing with 500-600 people, right? I mean, I've been in a hiring capacity. I don't know if you have too, and you get hundreds of resumes and you just don't have time to sift through that. So if someone can tell you, hey, check out this person or this person comes highly recommended, you can trust it. That's really what gets you in somewhere, I think.
Yeah, I have to add on that. Yeah, I'm very introverted, so I hate networking, to be honest. But LinkedIn is very, very powerful. I got my job currently now because I was out there on LinkedIn posting, you know, like I was updating constantly, and recruiters come at your door once they see all the experience that you have. And I basically got a lot of interviews through recruiters, and that's how I landed my role. So as much as your experience is really important, like while you're interviewing itself, like they'll ask you questions about what you did. Being active on LinkedIn is so important now. So important.
Couldn't agree more with that. I think both the remarks and input that you've heard from our panelists, I think really give support to the phrase or the statement around your network is your net worth. And, you know, really it is who you know. But I think even hearing this point is a great segue into my next question for you. So we've talked about the value of those relationships and who you know. But can you both share with me or share with our attendees today, what are some best practices around building relationships? So I think all of us here know what LinkedIn is and how it works, but not necessarily how to best leverage LinkedIn or how to best build relationships or how to best network. Or to your point, those of us that may be introverted are like, oh, do I have to do this? You know, right? So what are some best practices that have been helpful for you and continue to provide returns in terms of building those relationships, networking, or even opening doors?
Well, first of all, use LinkedIn. If you don't have one, make one. Connect with people that you know already. So like in school, whether it's your undergrad or, you know, your actual friends, and then people will start finding you from there. If you can, you know, try to join NYU groups or other relevant groups. And kind of look on people's LinkedIns that are getting those job offers. So I like have a friend who gets so many job offers because she job hops all the time, but the fact is she's getting a lot of job offers. So I basically copied her template. You don't want to necessarily put your entire resume on there because you want to keep them guessing, kind of thing. But if you can put something that's important on there under every single one of your roles and cater it to roles that you want, the recruiters will come for sure. Like, but don't make the mistake of, like in my case, all I had before was clinical research, and a lot of people want people in clinical research, which I didn't want anymore. And I learned very quickly that if you only cater your profile to that, you're gonna get all the jobs you don't want. So definitely cater your profile, talk to the right people. If you have friends that you know they're in the same field or a similar field, ask them for what they hear about in their roles too, like what departments are looking to hire.
I need to look at your friends.
So
Template, because
So good.
mine probably does just like my resume, you know, on LinkedIn, but don't be shy. I mean, I know it's not comfortable to network. I'm telling you, I don't like it, you know, but like you have to do it and be open-minded. My father always said that to me, and I never really understood until now, which is talk to the people, like you mentioned, talk to people who you know, but talk to people who you don't know, who are you know, completely different sectors than you. And believe me, you come across people that in some way or another just connect you to someone else, right? Or say, oh yeah, I did this course, or I did look into this job, or I'll talk to my friend because she works there. So just be present, like go to as many like networking events. When I was at NYU, we would have speakers sometimes come to our classes, and I guarantee you the only like the few people who got a job in 2009 were those who would like beeline to those speakers. And I remember thinking, what an opportunist, you know, but it's like, no, that girl got a job, you know, doing that. And that works. That works. It doesn't come naturally to me to be, it seems like you're like kissing someone's ass, you know, like, but you have to. It's like, that's what you do at work. That's what you do every day in your life. So make it work to your advantage. And yeah, let go of your shyness. Leave that at the door because it's not going to help you.
I'm just preparing myself for anybody that's preparing to beeline our panelists. After this, so just being prepared now. I think we're getting ready to open up the panelists to questions. Let me ask you one more question, and then we'll move on to that. So we've talked a lot. I think there's been some great information shared this evening. I think there's been some great wisdom, advice, expertise, and even insights around what public health is, the impact that it has, and what GPH has done for your careers. But we're talking about, not only traditional, non-traditional pathways in public health. We heard a little bit about where you work at the beginning. I've heard a little bit about it in some of the questions that you've answered. What do you enjoy the most about the work that you do, right? Currently.
Currently, well, I love that I work more broadly in immunizations now, because before it was just COVID. And while that was very fulfilling at the time, it got very tiring. Like I was tired, I was burned out, not gonna lie. But I'm really happy that I'm not just doing COVID vaccinations right now. As weird as that sounds, I'm glad that I'm also doing like flu, RSV, measles, anything basically that's seasonal. So that really broadens the spectrum. I like the feeling that what I'm doing, even if it's pretty menial, like, sending a comm out to a few stores that a new shipment is coming in or something like that, that I know in general, that shipment will make it to someone. So I know that someone's getting vaccinated. And that makes me feel good.
Can I add one more question? And you'll have both of these too. What has surprised you the most, though, about the work that you do?
What? I guess the fact that, well, okay, so I guess before CVS, I was very much in the public sector of healthcare. So, I guess I was surprised, but I shouldn't have been, of the capacity for a lot of stores to forget what we're telling them, if that makes sense. So a lot of things, like I just have to know, like in the back of my mind, I have to keep repeating, and it's not their fault that there's 9,000 of them. But like being able to be clear in comms, to be able to answer questions and being patient. Pharmacists don't just look at our comms, they're doing a million other things too. So and from going from everyone's hot on COVID to this was kind of like a culture shock for me, I guess.
All right, same questions.
I'd probably say I'm the least academic I know, meaning I don't intend to pursue a career in academia, and I didn't go into a doctorate thinking I would pursue academia, but and I'll say, I mean, I probably shouldn't say that because my students might hear me, but in teaching, I think what I find most rewarding is when someone comes to me, like during the semester, and says, I changed my major to public health because of this class. And even more special to me is when people say, I want to do something in One Health. Like a lot of people don't know what One Health is. And when they complete a class with me and they tell me, oh, it's just so fascinating, it makes so much sense, I think that's super, super rewarding. What I have found very surprising is how many people don't know what public health is. Oh my God. I mean, even my public health students, it's like I have to beat it into them that it's not healthcare necessarily, right? Like a lot of times people just conflate the two. And I always say, I've done everything professionally and personally to stay out of the world of healthcare because I think it's a disaster, frankly, in this country. Our healthcare system is beyond broken. And I think that's one of the things that stands out the most to me is one of my professors at NYU. I can't remember the class. I think it was healthcare systems, something like that, said we don't have a system in the US. It's a non-system. And I always tell my students that. And so I steer so clear of healthcare. But it's still how much people conflate public health and healthcare, or ask me, oh, aren't you're a nurse? Oh, you're a medical doctor, So I don't know if that's our fault. Maybe we don't communicate well what public health is. I also think it's an indictment on how our society undervalues public health, right? We had our 5 minutes of glory during COVID. And you probably saw people oh, everyone knows what public health is. And having people tell me oh, thank you, you're an unsung hero, and then that just, it goes away like that. When it's the next, the pandemic goes away, then we're sort of in the shadows again and people don't know what it is.
Wonderful responses and wonderful input. Thank you for answering those questions. We're going to open it up to questions now. And as I shared at the beginning, we're going to start with our first question from our attendees online. And then I'm going to actually ask anyone here in the audience in person if they have a question. So with that being said, we'll take our first question online. Do we have our question?
Not yet.
Not yet? All right, no question.
We've answered.
To submit.
So for those of you that are joining us online, please, we encourage you to submit your questions and we will be able to see them, and then I can share them with the panelists and with the audience here in person. So we have about roughly just over 20 minutes before we're done with the panel. So there's still some time to submit. But with that being said, I'm going to open it up to the audience now and ask if there are any questions. So anyone here have a question? And if you do, please raise your hand. And when you raise your hand, just share your name. And if you're a student or an alum of GPH, also share that too. I see a hand raised.
Yes, my name is Nahom Daniel. I am a student. I'm an MPH epidemiology concentration. I actually had a question for you, Elena, regarding your background. So kind of a two-part question. One, the DRPH program, I'm kind of interested, I guess, the value that it brings in comparison to the MPH. I guess I always hear controversy, is it really for MPH students or is it for other professionals who are interested in public health or are more terminal? And then two, how has that helped you become a lecturer? Usually I've always associated with you need a PhD to kind of teach, public health. And I'm interested in teaching. So is that an avenue that's possible without a PhD?
Yeah, sure. So do you mean, do most people that go into a DRPH or pursue one, do they have a public health background, like an MPH?
Yeah. And if not, is it still useful if you do?
Yeah, so my program, you have to have an MPH. So at Rutgers, a school of public health, they require an MPH. And if you don't have one, I think they allow you to do some sort of a certificate it takes 6 months or something like that. So all of my cohort, we all had an MPH coming into it. I have to say, people told me before I did years of background research before I decided to do a doctorate. And I was between a PhD and a DRPH, and I toured some schools. I was like interviewed as a finalist at some schools. And I realized then that like a PhD wasn't for me because I'd been out of academia so long at that point that I felt like I was everyone's mom, you know, like that was in the interview process with me. They were all very young. And what I love about my program is that they're all middle to high, sort of advanced in their career. So we had to have a minimum of like 8 to 11 years of professional experience. So that's been really great because you are learning as much from your professors as you are from your peers, right? In fact, we see each other as peers, like the professors and the RPH students. However, a lot of people told me don't do, including some of my mentors that I had while at NYU. If you don't want to go in academia, don't do a PhD. They told me over and over. And I have to say now, it's painful. A doctorate is hard. It is hard, especially when you're working, because that's what I'm doing now, trying to balance doing my dissertation. I think that's why so many people stay ABD forever, you know? So I don't think you need a doctorate to do most things that you might want to do professionally in public health, unless you really want to go into academia and go into the tenure track. I get to teach because we have to, like as part of our doctoral training, we all have to teach. And I've just stayed on doing it while I look for something full-time, actually. Now that I'm out of my coursework, I'm looking for something full-time. But I'm not considered like a professor. That's why my title is lecturer, right? You have to have your doctorate to be a professor. But you can teach. I know also at CUNY, like I have friends who teach undergraduate level courses and they have a master's.
Thank you for your question. Really great question. Really great question, by the way. I'm gonna open it up again. Do we have any questions?
We have one
Okay.
on Zoom. What kind of support do you wish the school gave you to be empowered to succeed?
So I'm gonna repeat the question just so that everyone heard it. What kind of support do you feel the school could have given you, you know, so that you could succeed? And I'll open it up to both of you.
So at the time when I was about to graduate, I definitely I think it's a bit different now, but I definitely wished there was more support in internships. So like I definitely wished like there was more opportunities for the school to kind of like say, hey, these are internship programs that have a reputable, like have a good reputation. A lot of our students went through here. And I wish that I was able to kind of have access to those, and maybe it wouldn't have been as much of a convoluted struggle to eventually get to where I am now. And probably a bit more support on resume and LinkedIn usage. So resumes we did touch in a lot, but LinkedIn, I didn't realize how important that was until it was near the end of my education here. So definitely wish there was some tips on that too.
No, definitely, I agree with you on the internship process. Like I often think like, why can't a school of public health function almost like law school or when you go to business school, which is like, you basically have a job before you graduate, right? Like they help place you in internships. They pay you, you know, like we don't get paid. Like none of the internships I've really done in public health pay. I mean, if you get like a Metro card, you're lucky, you know? So I wish that I don't know. And I think academics aren't great at connecting people. They're not like the whole networking thing. I think they're in this like ivory tower of academia. And it's like, how do I get to this tenure track? So I would constantly ask professors, I'm not going to say which ones, but they're probably retired most of them by now, but like, hey, you used to work at the Pan American Health Organization. You know, like, can you help me out? And it was like, they didn't get it, you know, like, what do you mean you need help to get a job, you know? So I think there needs to be a lot more mentorship, as well as, like you said, connecting to internship programs that help you get a job, a paying job, because we deserve to be paid for our work. Yeah, and as well, like I said, psychology, I think that we have to have at least one course in psychology in public health. It's strange that we don't. We can't talk about behavior change without psychology, you know? I guess that's it, yeah, but more mentorship, I think, and connections. Like, if you're well connected, use them, help people, right? That's how I think, and that's how I help people when I can, you know, when students come up to me, and I'm happy to write recommendation letters. I'm happy to make connections with people, but academics, like, that's not their forte, I'd say, you know?
Wonderful. Thank you guys for your response. Thank you so much. Yeah, so many great points shared. I almost chimed in there to offer some of my thoughts as well, right? 'Cause, yeah, there's a lot of things, there were a lot of things that resonated with me as well. Thank you for that question from our attendees online. I'm gonna come back to our audience here in person and ask, does anyone else have a question for our panelists? Oh, hi.
Catherine White, for soon-to-be Dr. Promeyer. Since you say you don't need a PhD to get a job, what sort of job are you looking for?
Are you offering? So ideally, what I want to do is I want to leave the public sector. I want to try the private sector. I've been in the public, yeah, you don't have to tell me twice. Like, it's been very fulfilling, I have to say. Like, I've worked for so many community-based organizations, small and medium, primarily local health departments, NYU, I was at Langone. I've worked primarily though for nonprofits. That's the problem. And that's, I wish someone had told me this. Like, when I was doing my MPH, I wish someone had sat me down and said, listen, unless you're independently wealthy, unless you're going to inherit a lot of money, you're not going to make a lot of money working in nonprofits. And you don't go into public health to become rich, right? I mean, I knew that going in, but there's a difference between a salary that you're probably making at CVS compared to someone who's at a small or medium-sized nonprofit. So I'm hoping to, like, I interviewed with Deloitte. They have their new Center for Health Solutions. So a lot of these big companies now have these like centers for health equity. I think the tragic killing of George Floyd, a lot of that sort of pushed equity more into the spotlight. So they're investing a lot more money and resources, these big firms. Ultimately, that's what I want to do because I rely on myself financially. Like, I don't plan to get married or I'm not going to inherit anything. So like, I have to worry about how much money I make. And it's okay to say that, right? Like, we shouldn't feel like martyrs, you know? And I think that's what this concept of the community-based, like, nonprofit world is like. You're supposed to feel like this is charity. And it's like, no, man, like it's my career, you know, I got to feed myself. And to live in this city, like, you can't make $60,000, $70,000 a year and pay your rent here, you know? So knock on wood, I eventually go into the private sector.
Thank you.
I kind of have to add on that. So before I was at CVS Health, I was with the VA, and then I was with Health and Hospitals, which are both public sector work. And yeah, it was great. And I, like, especially with Health and Hospitals, would not take any of what I did back. It was great. I got so much experience, but I am very happy to now be in the private sector. And like, to your point, yeah, everything she said. I think it's important as public health professionals that at some point you are working in the public sector because you do get a lot of important experience that maybe the private sector won't be able to highlight or won't want to. And it definitely also, like, to be honest, makes you look better on paper because people like in the private sector and other public sector will ask about your work, and it's great, and I totally acknowledge that it's very important work, but it does burn you out eventually. Like, I can't emphasize how burned out I got after those 2 years of Health and Hospitals, as great as it was and as fulfilling as it was, eventually you do need to think about yourself. And public health doesn't just mean public sector, it means public and private sector. So especially in this kind of country where we have a non-system, the truth of the matter is that our non-system has both public and private sector. So whatever you do, you're going to be helping the public. So it's not going to be something that diminishes your degree or your values. It just means that at some point you need to think about further in your future.
I appreciate your candid responses. No, thank you, thank you. And just to add a little tidbit to what was shared, public health has, especially since the pandemic, especially since 2020, has seen a serious uptick in terms of interest from companies, organizations, firms across all sectors, but particularly what you see in the private sector. And the point has already been made, you know, you're finding many companies, many firms within the private sector that are building out health equity, you know, arms or public health arms, because they now understand the business case, they understand the value of public health. All of that to say that public health has always been amazing in creating waves. It's just finally getting the recognition that it deserves, you
It
know?
only took a pandemic.
It only took a pandemic. It took a pandemic. Okay, we'll move on to our questions. So that was from our audience. I'm sorry, that was from our audience. So our next question is coming from our attendees online.
So this, I think, actually segues great. It's from an MPH alumni and a current DRPH candidate. When searching for a job in the private sector, how do you navigate career ambition with ethics and morality? For example, working for a controversial pharma company.
I basically lost all my ethics and morality. And I say this happened just, but like, I mean, 15 years in the public sector, it beats it out of you. I mean, it's like, you can do good in private sector. I think it's just been like, I don't know, so stigmatized, right? Like, but no, I mean, yeah, the bottom line might be the dollar, right? But like, it is for me too. We live in the most capitalistic place on this earth, you know, and how are we going to compete? How are we going to compete with public sector jobs? And we need, like you said, we need people to do it. Like I'm glad I did it as long as I did, maybe not that long, but like you need that experience. I think you really, you get more into like community level work when you work for the public sector. But I don't know. I think that's a false dichotomy. I think that's a false narrative to say that you lose your morality or your ethics when you go to the private sector. I mean, yeah, like I don't have any ambition to go to like Pfizer or anything, but like if I did, oh well, you know, like they do good things too, right? They make vaccines. So
I have to agree with that. I mean, like when I did clinical research, I was working with Akebia Therapeutics, so that was very much pharma. But like in the end, yeah, you're completely right. In the end, whether you're public or private sector, there's going to always be a dichotomy. So you don't know like what your morality is, you just have to know yourself. You know, and there's a lot of stigma for maybe someone in public health to go into private, but you have to ignore it, to be honest. Like in the end, as I said before, you're always going to be doing good because your public and private is just always going to be together in this country. And no matter where you go, whatever kind of healthcare system there is, there's always going to be something for you to do. And that's fine. Like, to be honest, when I went how many years in the public sector into CVS Health, and then I was listening to some like the early meetings, I was definitely having an identity crisis. But then I realized, you know, like I'm not the one running the show, and I don't always know what everyone else is talking about. So like I'm not the business person, maybe someone else is, and that's fine. Like in the end, like the private sector has to make money, and that is the end game. But also, if you think about it, who gives out the most vaccines? And it's probably the private sector. So you have like, besides CVS Health, you have Walgreens, you have, you know, Rite Aid. Like, where are you gonna go to get your vaccine? It's most likely not gonna be the hospital. And if you just think about it as an umbrella, situation, you definitely remember your place, I guess.
Yeah, excuse me, I agree with all of those points. We have time for one more question, but I'm gonna share something that you'll be the one. You're gonna go with that answer. I'm gonna share something really quickly, and that is that, I think that question that was just posed touches on a really, really, really important point that both of you have already highlighted. I've worked in the public sector, I've worked in the private sector, and I've worked in the social sector, right? And so at the very beginning of my career, I worked for a pharmaceutical company. We were conducting global clinical trials to basically create a drug and a cure for multi-drug resistant tuberculosis. The largest prospective drug trial ever to be conducted spanned 5 continents. It was huge, it's major, right? And I remember at that time in my life, I had a perspective similar to that question, that point that was brought up in that question. Pharma's bad. They're the bad guy. Don't go work for them, right? They don't do amazing work. And I was proven wrong right there. I learned so much. I saw so much. I actually had an opportunity to really see what health equity looks like in the world of biotech, in the world of clinical research and pharmaceuticals. So I think the discussion today is really doing a lot to debunk some of the myths and some of the misconceptions that may exist around working in the private sector. And hopefully attendees and both here in person and virtually are, taking that from the input that we're getting. And with that being said, we have time for one more question. So going to close it out for us.
Hi, I'm Andre Sanchez. I'm going to start with a little bit of a comment so you understand the context of the question. From my perspective, when we talk about nonprofit organizations versus for-profit organizations, the biggest difference I see is that one calls it margins, the other one calls it profit. But at the end of the day, there's a gain to be had regardless of what you call it. So for kids that are entering the workforce, what would you recommend in terms of how to identify what a good opportunity is, whether it's with the private or with the for-profit or nonprofit sector?
It's a really good question. For me, first and foremost, is growth. I've felt hamstrung quite a bit. When you work at small and medium-sized nonprofits, there's not much room to grow. Oftentimes, you're like director of something, and then above you is executive director, right? And that's it. So I think that's something that I wish I had asked more or understood better about whatever organization I was interviewed by or approached by. But also, I mean, I was just like a product of our lousy economy and job market. And, the Great Recession that we had, that's probably why I've dipped my hand in so many different areas of public health, is because you take the job that you can get, right? And that's something that was really useful to me to hear when I was doing my MPH and about to finish. And it's like, I remember I had fellow students who thought they were going to go off and, get hired by the WHO or the UN or something. And it's like, those places are so competitive and so hard. And what do you have just coming out with an MPH? You have a lot of theoretical knowledge and information, but what experience do you have? So you have to humble yourself too and understand that it's going to take time to get to a position in your career that you feel proud of, where you feel financially secure and independent. I'm still trying to get there, but I think growth to me is the most important thing, because I don't want to job hop that much, right? But if there are no other opportunities for you to grow, then you kind of have to, or you're stuck. So that's sort of, I think, the benefit of somewhere like CVS or Deloitte or these, big agencies, these firms, is that you can grow a lot more, right?
Yeah, totally agree. I also think that that with things between nonprofit versus private sector, you always just want to look for just in general culture of the company. If you're not happy working there, or if you can sense you're not going to be happy working there just from the interview, don't take it, because in the end, it's just going to make you very, very unhappy. And as much as you want to do what you need to do, you need to get along with the people that you're working with too.
Wonderful responses. Thank you so much for sharing your thoughts, your input, your insights. And we are at time. Exactly 6:30. Thank you, everyone, for being here. I hope you enjoyed the discussion today. For our attendees that joined us virtually, thank you. We appreciate your attendance as well. And please stay in touch with us. Oh, and we've touched on LinkedIn. If you're not already connected with the panelists, connect with them. So thank you again, everyone.
Thank you.